Another question that keeps comes up, and if someone's on methadone maintenance, what do they talk about methadone maintenance?
Right. So those are two separate questions, and the question of cure is one we're doing a lot of work on in our center. We have so many databases, and I showed you the cohort of heroin users, but we have similar longitudinal cohorts, not quite as long perhaps, but of methamphetamine, cocaine users, et cetera. And we've actually been doing a lot of analyses lately, looking at probabilities of relapse over time based on successive years of abstinence. And what we have found is that after, so each additional year, each successive increases your likelihood of additional year of abstinence. And about 3 years, what we're seeing is it starts to plateau. Other people have said 5. There's a very arbitrary nature to the 3 to 5 cutoff, but statistically, you do start to see, if I had to give a number, 3 to 5 seems to have statistically much diminished probability of relapse. That being said, we know that even after decades, some people can relapse. The question of methadone is a very interesting one. And some people, of course, view this, that there should be no necessary endpoint, that an opiate replacement therapy, if what we're treating are changed processes in the brain that are permanent, that there may be no necessary termination endpoint in that treatment, in the same way if you use the insulin analogy with diabetics. On the other hand, methadone has a lifestyle effect. The daily dosing, although there are other treatment options now that may not require daily dosing, but nevertheless, there's a treatment lifestyle effect that many people don't want to be on the treatment forever. And there are some ways that people can be tapered off successfully. It requires a lot of supervised and supportive treatment. And again, the question is, do we want to invest in that and do that? But I think it's extremely important, and I think there's a lot of good work being done now in trying to understand who can do that tapering.
Fascinating talk. Thank you so much. So the speakers can see the front. Let's come back at we'll give you 11:15. There's one bathroom over here. There's a lot of bathrooms in the building next door.